Welcome to Tea and Cornbread, a conversation with Shawne and Tracy, where warmth, wisdom, and community come together. Just like a good meal shared with loved ones, our podcast brings heartfelt conversations with incredible people who are making a difference.
We spotlight community leaders, change makers, and everyday heroes who uplift, encourage, and support those around them. Grab a cup of tea, pull up a chair, and join us as we share inspiring stories, real talk, and a whole lot of love. Because when we come together, we nourish more than just our bodies, we feed our souls. Hey everyone, welcome to Tea and Cornbread with Shawne and Tracy. I'm Tracy.
And I am Shawne.
And I am laughing.
We have a very, very wonderful young man with us today. Dr. Smith.
Dr. Smith.
Yay.
Yes.
We'll get into doing our standard breathing. We'll read from our affirmation for this morning, and then we will get to talking to Dr. Smith.
All right.
Telling us all things about him.
All things.
All things.
All things about him as a cardiologist.
Yes.
Okay.
Yes. Oh, no, we getting personal, too.
Yeah. Okay.
But anyway, okay, let's get started, my sister.
So how was your weekend?
My weekend was great. We had an event yesterday, which you were there with your new co-op.
North End Co-op.
Yup.
Mm-hmm.
Your
Juices.
yup.
Okay.
And
I don't know
New
what's
Path,
going on
New
right
Path
now.
Wellness information, and we had other vendors that was there. Very informational, like we said. To my left, we had the doc there. He gave out some good information. Had talks with the people. They loved him.
Yeah.
And I'm very excited to have met him yesterday. I don't know him, even though he grew up in Waterberry, but he'll get into that a little bit later.
I will.
Yeah. Yes, sir.
It was a great event. It was
Definitely.
given by Black Women United,
Yes.
Bridge to Success. There was one other group. What was the other group? I forget.
I
the
don't know. I
other
was
group.
representing Empowering Your Body.
Oh, there you go. There you go. Empower your body. But it was to celebrate the men in our community
Yes.
that's doing extraordinary things. So
It was an
I
awesome
loved
event.
it.
It was.
And we knew everybody. That was great. You know, they were all born and raised in Waterberry.
Yes.
And from all ages and all different ways that they service the community.
Yes.
It was awesome. And of course, Dr. David Smith, someone I grew up with. And he, Little Dave, we used to call him Little Dave, is in church. Yes.
I'm not. It's our secret. But we are so proud to have him here.
Yes,
but
I'm so
I have something
proud.
to say, too.
Okay.
I won first prize yesterday.
Yes, you
because I
did.
ran around Fulton Park
You know,
2 times. It was walk and talk with the doc.
you should have been excluded.
And you know why he's saying I should be excluded?
Why?
Because none of the men,
One
one of the men, yes, one of the recipients, Ian, I think his name was,
Okay.
he came in third. And the doc was like, I don't understand why all these women have the trophies when it's a man event. You know why? Because they didn't walk. They didn't run.
They don't walk or run.
Because now we got you recorded. The reason why it's called a men's walk, but you said you ran. That means you cheated. That means you're disqualified. So a man did win.
Doc, you want me to call you out right now?
Nah,
Did you? Doc.
No,
I didn't.
we're not having that.
Doc,
We're not-
I didn't.
Tracy,
we started pushing.
Yeah.
restrain
Okay.
yourself.
Okay.
Restrain
We stop. But no, yesterday's event was an awesome event.
Yeah.
Arlinda and all the groups, they always put on wonderful,
Yes.
wonderful events. And we do want to say that we appreciate you for coming in and gracing us with your presence and your
Yes.
knowledge, the education that you gave people. It was just awesome. They were crawling like
Yeah.
crabs in the barrel to get to you.
They were.
Every time I turned around, they're like, I want to talk to him. But every
Yeah.
time I turn around, he's talking to somebody else.
Oh.
Yeah, I had to intervene a few times. I'm like, Doc, this way.
Yeah,
Doc,
you did.
over here. He probably was like, who is this lady?
I was like, I can't wait to talk to her the next day. That's what it was.
Yeah.
Awesome.
Yeah,
We're glad you're
yeah.
here.
Yes, thank you. Thank you
thanks.
again for accepting the invitation.
Definitely.
It's definitely more than I thought it was going to be.
It's
It's
more
really
than-
good.
Yeah. Oh, awesome. So let's talk about that. Well, first I want to introduce you again, right? I'm going to read your short bio here. I know you don't want me to, but
know.
I'm going to anyway. For those that don't know who you are, okay? So this is Dr. David Smith. is a graduate of the University of Connecticut and Robert Wood Johnson Medical School. Dr. Smith is trained in internal medicine, vascular biology, and cardiovascular medicine at Yale University and currently is an assistant clinical professor. He has been the site principal investigator on numerous studies in cardiopulmonary disease. Dr. Smith has published in vascular biology, statin endothelial.
Endothelial.
Thank you. Endothelial interactions. Did I still say it wrong?
It's okay.
It's okay.
This is doctor. He got to pronounce it.
Dyslipidemia, right? In sleep apnea and disparate say it for me. Listen.
I never read that.
All right.
So
Relevant clinical outcomes.
Oh, ethno-relevant?
Yes, there you go. Thank you. NIH Pride Scholar, past board member of research chair for the Association of Black Cardiologists. Dr. Smith is a fellow of the American College of Physicians and American College of Cardiology. Thank you, thank you, thank you. All of that.
Yes.
Yeah, but there was more. I found more on you, but you know, we won't go there. We
Okay.
won't go there.
We'll let you talk about
but,
it.
I mean, you are
That's why we're
very,
not gonna-
very astute in all of these different, you know, when we talk about cardiology and we talk about biology, vascular biology, that's the veins and all. So what I love about this is that it's a multifaceted. So you're not just a cardiologist, internal medicine and things like that, but I feel like, okay, let me bring it back, right? That it seems like when you're going to specialists, they only concentrate on one part of the body. And where for you, you're concentrating basically on the full part of the body. You know what I'm saying? Like all the organs that work together, your lungs, your vascular system, all of that. So I appreciate that. And I want to talk about a little bit about what you said yesterday. There was something you said yesterday that I was like, we're going to bring that up and go more deeper into that. Because, you know, we're about natural wellness. You know, we're about that wellness piece, the whole body, not just one part. And what do you do to get to the part where you have to prevent surgery? But we won't go there yet. So let Ms. Tracy here have a couple of questions for you. Talk about.
I didn't have no questions.
All right. Well, listen.
No. So I'm just kidding. No, so for real,
But
I do have a question, and it's just a basic question. What got you started in cardiology? What made you want to go into the medical field?
Those are two different questions.
Well,
All
answer
right,
both of them.
So, all right, cool. So it's I don't even know how I want to.
come closer to the microphone.
All right, I want to be
Be yourself.
diplomatic.
That's
right?
what we
'Cause
want.
Here's the thing, right? So it's gonna sound weird, right? So my mother, when she came from Jamaica, I'm first generation here, right? So when my mother came from Jamaica, she loved medicine. She wanted to be a nurse and wanted to do all the rest of that kind of stuff. But when she came here, of course, she had to go through all these extra, hoops and stuff. And she couldn't. So she ended up working in a hospital and doing a lot of other things. And I would just go there. I remember she'd bring your kid to work, and I would just see all these other people. And I'm like, Mom, I'm going to be there. I'm going to be the boss. I want to be a doctor. That said, I also had another pediatrician here in Waterberry, Dr. Baldovi. I don't know, some people probably knew him. He's a Filipino guy. And he had this hair that just came out stuck, and I wanted my hair like that, too. And so you put both of those together. I said, I want to be a doctor with the hair like that.
With the hair like that.
Yep. And then so that was it. Once I was 6, 7 years old, I knew I wanted to be a doctor.
Wow.
But that wasn't going to get me there, right?
Right.
So it wasn't until I got to Driggs Elementary that they started giving out these awards and these trophies. I wanted an award, right? So it was third grade, and my friend Adriana Trijos won an award, and it was a nice trophy, and it said high scholastic average. I had no clue what that was. And so I ended up talking to the teacher. She said that meant she had the highest grades in the class. I'm like, what? Like, she had higher grades than I did? Yeah, so, okay, that's not going to happen again.
That was your goal.
So in other words, I'm very arrogant.
I'll call it competitive.
Yeah.
I'll call it
Well,
competitive.
guess what?
I'll call it competitive.
very competitive.
Shawne?
Okay.
Very competitive. And, so that's where I said, hey, listen, it was medicine. I'm going to be good at it. I'm going to have to get it done, period. Right? And so that's it. It was just full steam ahead. Now, why a cardiologist? It's a little bit different. So when I it's so weird. You always have to have somebody reaching back. You should, maybe not always, but you got to have somebody reaching back. And again, my mother's Jamaican. My whole family's from, the Caribbean, from Jamaica. So none of them were really able to say, hey, Dave, this is what you need to do. This is what you need to major in college. I didn't know what the MCAT was, the Medical College Admissions. I didn't know what that was until I think about a year before I was supposed to take it. The only way I knew all this stuff is there was a doctor who worked with my mother, Alex Ortiz, and my mother said, hey, my son wants to be a doctor. He said, oh, really? Came up and gave me these 2 big books. They were both 3 inches thick. And he said, when you're done reading that, give me a call. I was like, what? So anyway, he was at Yale, internal med, and he said, Dave, I'm going to teach you everything you need to know. I did some classes with him, knocked out the MCAT, and I said I want to be like him. So then I knew I was going to go into internal medicine. We can tell pretty much in the first 2 weeks of medical school what you're going to end up doing. Ask me that later if you want to.
I will.
So then I went through. I was finally able to. I told you I want to be like him, and I'm driven, I'm competitive, and I knew he was at Yale, so I'm like, I'm going to be at Yale. So anyway, they told me what do you have to do. You have to be at this percentage, and so I said, all right, I did that too. Then he wanted to be a cardiologist, so I kind of wanted to be a cardiologist, and then so I was wavering back and forth, and then 2 things happened. The director of the program said, hey, listen, you need to be what you don't mind waking up at 3 o'clock in the morning and deal with. And I was like, well, that's not going to be nephrology. So I'm not writing dialysis orders at 3 o'clock in the morning. So that was half of it. Then the other half is we had a guy, Sander. He was a pulmonologist, which gets to your point. He said that he didn't want me to be a cardiologist because cardiologists get lobotomies. Like, as soon as you become a cardiologist, you forget everything else that you were taught. That's what he said. And so because of that, I said, no, that's not going to happen here. Again, that competitive, arrogant, competitive.
That's not arrogant. I don't think it's arrogant.
Me either.
All right. Well, then I don't either. It's competitive.
Yes.
Get it, that part. But that's it. That's all I got to be a cardiologist. I keep hitting something.
You're
you're hitting the
you're-
table.
Yeah, that's
All
okay.
right.
'Cause
We're
you're
here.
Good.
We're here. We're here. So that's awesome. That's awesome that you went to those different things. But what is it that you like the most about it?
About cardiology?
About cardiology and internal medicine, because internal medicine covers everything. Correct?
Yeah.
Okay.
Well, so internal
Kinda.
difference between, I think family practice is probably the better one that says it covers everything because,
Okay.
they'll deliver you and they'll go straight through geriatrics.
Okay.
Like that. Internal medicine is really more adult medicine, but yeah, we are the specialists.
Okay.
In every organ.
And
And
that's
so if you really want to know what's going to go to internal medicine doc.
right.
Right. So you're wondering how and what I like about cardiology.
Yeah.
Keeps me in it.
Mhm.
Here we go back to the other one. Watch out. Tracy. It's the life and death one.
Okay.
If I were
It
to
is.
do one thing wrong, it's all over.
Right.
Right.
Okay.
So that plus the evidence that's out there, it's evidence-based. It's the only one that's as evidence-based as it is. We're not into, hey, yeah, take this, do that, because, my grandmother did it and she lived till 235 years old. And no, it's not that. You got to show me the data. And because of that, and the fact that it's so delicate and it's so serious and the consequences are so dire, I like being that one in charge.
All right. All right. I like that. So, okay.
Just got that look.
So,
No.
go ahead.
Am I
No. Go ahead. I'm just amazed. Like, honestly, I am. And kudos to you for following your goals and also trying to piggyback off those other cardiologists.
Oh, yeah.
That was awesome that
Yeah,
you
it's
even
amazing.
had people to look back and to kind of take you underneath their wing.
You have to.
Yeah. So
That's what I do now. I have four.
that's what I was
some
going to say.
mentors.
So how do you do that now, that you're in a position to reach back and help somebody?
Interesting. Yeah, so, because I was one of the panelists for Black Men, White Coats. They just
Okay.
had that here in
Yes.
Waterberry.
Yeah.
And so a lot of people that I grew up with brought their kids there. I was like, what? So they're like, hey, yeah, Dave, remember
wanna-
what you were going to do? Can you talk to my son, my daughter, that kind of thing. But in North Carolina, I have a couple of people who took the MCATs and they just bombed it. They just could not do well. And so, I took them under my wing to show them the same MCAT stuff that Alex taught me. And then I think going back to Kennedy, I did this thing here where I went back to the high schools, Kennedy, Crosby. I was supposed to go to more and just gave a talk. And then those people were just reaching out to others and say, hey, let's talk to David. So, yeah, that's it. I love doing
Nice.
that. I
Nice.
tell people, even other places too, I say, hey, listen, and again, this is the confidence. Ready?
Yeah.
I said I could teach anybody in medical school in about 3 weeks.
Oh, wow.
That's wrong. Well, yeah, I said that. It'll take 3 months.
It'd take at least 3 months, at least. But the good thing is you will take the time. It sounds like, to actually have a conversation with a young person that is like, what do you think? And then how many of those look like you? You know what I'm saying? Where that's very important for us because you talked about equity. That's very important for us to see us in positions that are deterred. That a lot of people have those stories of saying, "Oh, my guidance counselor told me I would never be this or
Right.
that or whatever."
I had that too.
You had that
did?
too?
Yeah.
Really?
Kennedy.
Talk about it.
No, I mean, it was really just that straightforward. She's like, hey, being a doctor is hard. You're probably not going to be able to do it. Most people don't. I don't know if you'll get into a college program that's strong enough. Maybe you should think of other things, blah, blah, blah.
And she didn't even know who you were as a student,
She-
evidently. Because
She
if
didn't know
you
she was
started,
gonna be mad.
right, she didn't know. She didn't know, right?
It was like the Incredible Hulk, right?
Yeah.
Don't make me angry.
Don't make me angry.
I'm going to show you. And you did. You showed her.
Yeah. And the good thing about that, too, is that's a great, what we didn't do?
I
Devotional.
know, but we can.
It's a great, example, to show someone that it's not about being arrogant. It's about being confident. It's about being, it's about being competitive. You know what I mean? Because we use those words as negative against
It
our
don't mean
own, right? And so, no, to take the word arrogant out, that's not it. Confidence, right? Somebody might have called you that.
That's
but
what I
to
was
me,
gonna
that's
say.
a negative
People probably say that to you, right?
conversation. But you know your stuff. So you can back it up. And so it's not about that. You're confident. You know what you're talking about. And you can teach our children, listen, hey, this is what you want. This is what they told me. And I said, yeah, okay, wait, watch me. Watch me now. Right?
But just so you know, back to the Alex thing. Alex is the one that used the word arrogant, so that's why I brought it on.
Okay.
Like,
Okay.
He's like, when you walk in the room, you gotta, command.
You got to command the room.
He's gotta, yeah.
Absolutely. Yeah.
Yeah, kind of like you walked in yesterday. You commanded the room.
I don't think I did that at all.
You did. I watched you.
You
I said,
did?
Shawne,
Yesterday was amazing.
the doc's here. No. No, you were pretty laid back.
Yeah.
You were with
I'm
the
always
people, and I
laid
like
I mean,
that.
but you seem
You
comfortable.
made them feel. Yeah, you
Yeah,
made everybody feel comfortable.
Yeah.
You
Because
remember
if they
Jamaican
were-
stuff, right?
Huh?
You remember that part about being Jamaican, right?
Yeah.
You're gonna make everything cool.
What? No.
Everything Irish.
Everything cool. Everything cool.
No, you did. You made them feel comfortable, and this is why even after you spoke, they were still wanting to pick your brains, tell you what's going on with them, help you problem solve for them. You know what I'm saying?
Yeah, and
So-
that's internal medicine with like the problem solving.
Okay.
thing.
Yeah.
Yeah.
Awesome.
So we tell people when you walk in medical school, we can always tell the ones who want to problem solve and figure out everything, they're going to be internal medicine. The ones who really don't care, they just want to cut, they're going to be surgeons.
Right.
Okay.
I
Right.
don't want to go through everyone because you never know who your listeners
exactly.
are going to
Right,
come at
right.
me.
No, not really. But
That's
at the
all right, I'm
same
ready,
time, it's.
You're being honest.
Oh my goodness gracious! This is one of the most difficult.
All right.
One of the most.
No, it's not. This is
No,
awesome.
it is awesome. So I want to talk about what you said yesterday about
Oh, she been
the
waiting for
equity.
this.
Yeah,
I see.
the equity piece of how that was. I was like, I never heard that. I never heard it in that way. When we talk about Black people are the most prominent in disparities of different health issues and things like that, and how you put it in a way where it's like, this is why. It's not necessarily because they're Black. It's about like the system and equity and access, right? And when I heard that, I was like, oh, I can't wait for tomorrow. But at the same time though, without going deep into it, because I really want people to understand the health piece of things, because you also talked about let's get to the root problem. Surgery is not the first thing to do. Let's talk about, when you talked about someone that was a heavy person that wanted surgery for weight loss.
I remember now.
Right? So the one for weight loss, let's start there, because you know what? Our audience we want to educate them on how to stay healthy and what, you don't always, because the biggest thing right now is the shots for weight loss, which is crazy to me, but it's okay, right? So let's talk about how you deal with your patients in a way where it's like, no, that's not going to be the first thing. I'm not just going to give you a pill. Let's talk about what you're dealing with and why. And then let's talk about your habits. What are your habits? What are the things that you're doing that got you here? Just because I'm a cardiologist or just because I'm a surgeon, usually they go through family medicine first and they refer to you,
That's true.
right? And so when they refer to you, it's because it goes beyond their scope to a certain extent. But then when they get to you, they're expecting, just in my experience with cardiologists, and I don't have one, I'm just dealing with people that have them, right? And even though the one that we're dealing with, he's not a pill pusher, but at the same time, he'll give it to you and tell you at the same time, I wouldn't be on any of those medications
Oh,
that
wow.
you're on.
like
But
that.
you know what I mean? But the thing is, because by the time they get to them, they've gotten so far. They're so far beyond reproach, right? So talk about that. Talk about how you deal with your patients and the way that you help them and help them to heal, as opposed to we can cut you. I can cut you all day long. But
It's
I
still
love
not gonna
when you
help.
said, right.
You're gonna get fat all over again. You're gonna regain everything you said. But yeah, what part of that? Because I did a whole lot of
I know,
talking.
but it's all right. Wherever you want to start.
Wow. No, so the person you're talking about was a lady. I think she was about 5'5", 5'2", 400 pounds, and said she wanted to get gastric bypass. I don't like that. I don't believe in it as a first choice, second, third, or fourth choice. I mean, if you don't, so the only way you're gonna lose weight, even with the shots, whatever you want to do, if you don't have your mind right, it's not gonna work.
Not gonna work.
If you don't have the right, and I wouldn't call it diet, but just your thought process about eating, the way
Mindset.
you eat, it's not gonna work. If you don't have the right activities in your life, you're like, yeah, I'm gonna take this shot, or I'm gonna cut myself and let them take out half my gut and see what happens. And then you're gonna turn around and sit on the couch. It's not gonna work, right? So that said, you have to actually think a certain way. You have to feel a certain way. You have to seek certain things. And if you don't do that, if you're not ready to do that, you're not ready to have any medical intervention, in my mind. And the good thing about being medically trained is you actually know there's more than one way to get through, to skin a cat. So, yeah, the way I do it is, I really want to make sure that, they're mentally thinking about what they're doing. And as a matter of fact, if you look at the American College of Cardiology, American Heart Association, they put those pills that you're talking about, the weight loss, they're actually in our guidelines as, as far as what to do. So here's the thing. If you're obese, you're going to be diabetic. Just wait around, right? And anyone with diabetes is essentially the same thing as cardiac disease. Like your chances of dying from a cardiac...
Say that again out loud. You are not saying it loud enough.
Diabetes is what we call a cardiac equivalent,
Okay.
cardiovascular equivalent. And
Okay.
that your chances of dying from a diabetic complication is about the same as if you already had a heart attack and you're going to get another one, that kind of thing. I mean, people with diabetes don't die of diabetes, right? You
Right.
die because you had a heart attack, stroke, or we cut something off and it gets infected. Right? Yeah, so something like that. But so obesity will lead to diabetes. Just live long enough. That's the way it works. And again, everything I say, these are general. I mean, you're going to find 5 or 10% of those people who it doesn't apply to. There's something called the obesity paradox where they get really big and nothing happens.
Nothing happens,
That
yeah.
kind of stuff. But for the other 95% of the people, this actually makes a lot of sense. So, what I do is, especially for this lady, I said, listen, this is what we're going to do it. To get gastric bypass, you have to go through cardiology because you have to make sure your heart can handle the surgery, the anesthesia, and all the rest of the stress and such. And then the post-procedure rehab, all those kind of things. So I told her, I said, listen, you need a stress test. I get it. But let's work out a deal. I think I said, give me 6 weeks. I'm going to get 20 pounds off of you, but you got to do exactly what I say. And if this works, you come off 20 pounds in the next 6 weeks. Don't ever talk to me about surgery again in your life. But if it doesn't work, fine, I'll do the stress test and we'll go ahead. So she came back 40 pounds down 6 weeks. It was very simple. For her, it was mostly a mental thing. She also had to believe in herself. Then she had to rethink the way she thought about everything. You know, food, I mean, people just throw it in because it's time to eat. What kind of junk is that?
Yeah. Yeah.
Oh, I happen to eat in a few hours. So?
Right.
And then,
Right.
you know, they say this other thing, I want to be paleo. What does that mean? You know, and
Or keto or
your
this or
keto
that.
yeah, I mean, look, the body is designed to do what the body's designed to do. And if you're going to tell me you want to eat like a caveman, well, then fine. But a caveman didn't eat a pterodactyl every day.
Right.
Like, cavemen didn't eat every day. So, you know, I mean, I think people say a lot and they don't really know what they're talking about, which gets back to cardiology. Everything's evidence-based. Don't tell me about what worked for someone else. Show me.
Show me.
I need a recipe.
Oh, so yeah, it's interesting. So I modified something from Joel Furman. He's a cardiologist out of UNC. He wrote a book
I'm
called
familiar.
Eat to Live.
Yeah.
Right with that?
Yeah. Yeah.
He has that 6-week plan.
Yeah.
I made a few modifications, but yeah, either way, it works.
It works.
Okay.
Puts food into the 3 categories. Like, 1, things you eat all of. Like, no one cares about calories. I mean, if you're eating right, the calories are not going to really
doesn't matter.
factor. Exactly. You're going to burn them up. Calories are nothing more than energy. You're going to take in the right kind of energy for what you need. And then there's category 2, which is limited. Those are the things that everybody wants to focus on: rice, bread, potato, pasta, sweets, and all the rest of that kind of stuff. They're like, you know, yeah, but eat brown rice instead of white rice, or sweet potatoes instead of regular potatoes, and wheat instead of, I don't know,
White.
whatever. Yeah. And I don't know, some people say crack is better than cocaine. I don't know how you want to put
right.
it. Either way you want to
Okay.
do it, they're all bad, right? So the thing isn't taking it. The thing is how much you're taking and what your body can handle.
Okay.
Someone like Shawne, I mean, she can have, I don't know, 2 or 3 sandwiches. I'll eat
Big
one
guy.
sandwich and I'll just blow up.
Right. Right.
It's weird. So then it comes down to insulin, and then you start getting biochemical, nerdy stuff you don't want.
Yeah,
But
I do.
to your point,
Come on.
but to your point, the doc should integrate that.
Right.
Stuff we know, we think of on the biochemical level. I was talking about cholesterol yesterday being nothing more than oil. It just solidifies in your body. And you break it down for energy. And because it has so much more energy than sugar, it's going to take a lot longer to break down. And people work out and they're like, yeah, I'm losing all this weight. You're not losing that much in fat. Mathematically, you're not losing much in fat. So, but we'll talk about that. But as a doc, the stuff you know, you learn it and you need to implement it. People need to understand it. And my mother used to say something. She was my best teacher, actually, honestly. She said something, and Alex reiterated it, that when you're talking, if you can't explain it to a 12-year-old and make them understand, then you don't know what you're talking about.
Okay.
It's crazy, but yeah, I think it's true. And that's it. That's the approach I bring to people. I'm like, listen, let's talk about it. Let's hear the whole thing. Let's think about the whole story. Let's come up with a plan. Bottom line is, I tell people this. Day one, you come and see me. I said, I'm going to give you everything I know. We're going to talk about it. Then, after hearing it all, we're going to figure out what works best for you.
For you.
But then the final piece is, we're going to go the way you want to go. But if you pick the wrong choice, I'm going to fight. That's
I love it.
That's the plan.
Yeah, I love it.
How does exercise play into all of that?
Thank you for asking. Well, we see a plan. Like, you
didn't know?
No, I did.
You didn't know, you know.
So exercise is very important for a lot of reasons, right? It's the reason why kids don't get that fat, right? They're always moving, they're always working. It's not, hey, I gotta go change into these booty shorts and go to the gym, and yeah, and you know.
I know I hate those people at the gym.
I can't stand it either, man. That's why I don't go to the gym. I got my own gym in my
I
house.
love the gym, but I hate seeing them coming. I be like,
It's ridiculous, right? And then you gotta spend whatever time to get ready, get dressed. 20, 30 minutes to get to the gym, just to look around for a bit, and then you work out for like 20, 30 minutes, act like it's hard, change for another 20, 30 minutes.
sometimes, wait a minute, Doc.
Oh,
Longer than 20, you got to be in there at least well, no, let me speak for myself.
sure.
I got to be in there at least an hour because I got to make it worth it.
So here's the thing. You ever heard of P90X, T25,
Yeah.
all those beach body things?
Yeah.
Yeah.
Right? So I did. You got to practice what you preach, right? So I did this. I lost 30 pounds in 6 weeks just doing this kind of stuff. So anyway,
Awesome.
here's the thing. If you do, like, you know how intense that stuff gets, right?
Mm-hmm.
If you did it for 30 minutes, like not cheating, like T30, right? Like not let me take a break, or hey, I'm not going to jump as high or fast. But if you did it, how many calories do you think you burn up in a half hour?
I don't know.
Probably about 400 or 500,
Okay.
right? So the next question is, how many calories in one single pound of fat? 3,500.
Wow.
So you would have to do T25 7 times to burn 1 pound of fat if that was it.
To burn 1 pound of fat.
Right?
Okay.
If you were to do it that way. Right? So, I mean, that's an oversimplification because, you know, you're burning calories just by sitting. And every time you exercise for the next few hours, you're still burning extra calories. So that's part of where exercise comes in, just by doing it, just by working, just by moving for the next few hours. Yeah. So
But is it healthy? I don't mean to cut you off, but is it healthy to lose that much weight in such a short time frame? Like everybody says, I don't know, I'll make this up, a pound a week or 2 pounds. You know what I'm saying? Like
they do some things like that.
Yeah, so
The lady I'm talking about lost 192 pounds in her first year. So she was,
It's
I mean, she
different
was still
for
overweight,
everybody.
right? She's still
Yeah.
200 something pounds,
Yeah,
right? If I
yeah.
something. But yeah, so you can handle it. It's about you and your activity.
all right.
But
And
so
everybody is different. Each person is an individual, you know, so everybody's response to different things. So like for me, I'm not doing the P90.
You don't
nothing.
need to.
I'm not doing that,
one
right?
needs to.
But at the same time, for those that do, it's still mindset when it comes down to it, right? And so if that's what you want to do and you want your body to transform or whatever, it will.
Yeah, it will. But where you were going is, well, why not exercise that much? If you are going to exercise, the bigger ones are the bigger muscles, right? So the lower abs, like the thighs, the booty muscles, you get those active. And that's part of why those track runners, the sprinters and stuff, they don't gain anything for a long time, right? They got all the booty muscles working. But no, the other part is if you're not going to exercise as much, right? Which again, you should do. You got to, get your muscles back to working. Think about it. How many calories you think the American diet is per day? Thousands, right? 2,500,
It's thousands.
3,000,
Yeah.
somewhere in that
No,
range.
because your first meal for most people is 2,000 calories or more.
right?
Just saying.
And I tell my kids all the time, the best pancakes in the world are McDonald's, some hot cakes, followed by IHOP.
Followed
All
by.
right, she's looking at me.
Followed by.
No, but anyway, that's
How about no and no?
but your point is the diet, the American diet is horrible, right?
Okay.
Now, so just imagine if we took away soda instead of drinking that, or like a juice, you wouldn't even recognize it, right? Or, what I learned about bread, right? It's, we're talking about limiting bread. When I was growing up, back in my day, right, it was like a slice of bread or something like that was considered a serving
Yeah.
or something.
Yeah.
Now it's doubled as a serving, or you can get bagels, which is 6 pieces of bread squashed together and they're fried.
Exactly.
And then we get a sandwich. It wasn't a sandwich. It used to be a sandwich back when I was growing up. Now it's a big old
Whole
grinder.
beef. Yeah.
And then that 12 thing used to be a whole meal, and you split some up. Now they're like, I'll just get that for lunch and
Right.
get more for lunch. And then I'll get a bagel for morning, and then rice and potatoes for dinner. I'm like, yeah. So you're just overloading the system.
Yeah.
What if you did part of that? You wouldn't notice 500 calories per day lost. You wouldn't
Right.
be able to
It
tell.
wouldn't.
Right.
Well, 500 calories a day times 7 days a week is also a pound. Changing that little bit of diet alone
Makes a big difference.
Yep.
Okay.
Makes a huge difference.
But why something you talked about yesterday too? You were talking about people taking the guy was there doing the blood pressure, and you were saying that those numbers change. I think normal is, and I'm not a doctor, 120 over 80 or something, right?
That's normal.
140 over 90 is high, and you need to be on a pill.
So the best way you just put it is you said you're not a doctor. That means you're the one that needs to know this.
I play one. I'm not a doctor, but I do play one.
Dr. Tracy?
Yes.
There was some sort of Tracy doctor. No, so yeah, the numbers changed a little bit, right? So Europe looks at it a little bit differently than we do in America. But yeah, so 140 over 90 is typically where we call you stage 1 hypertension or hypertensive. But that doesn't mean you need to go on a pill right away,
Okay.
right? The best way to deal with this is recognize that prove that your blood pressure 140 over 90 while you're standing or sitting right in front of me after you just walked in and you're scared of what I'm going to say to you is really 140 over 90,
Okay.
right? So
I agree with that.
the way my practice does it is we'll send you home with it's called an ambulatory blood pressure monitor. We'll tell you the way to do it. You got to sit down for 10, 15 minutes. Your feet have to be on the floor. Your
Breathe.
cuff, just
Calm
relax.
down.
Calm down.
Right.
Get your cuff wherever you think your heart is, right? We'll show you where that is. And then check your blood pressure and check it a few times throughout the day. And, I don't want to know your pressure is here and make a decision. I want to know what it does throughout the day, different times, and then we'll average it out. And then, if it's high, guess what? Yeah, you need to be treated, but prove to me that you need
That
to
is
be
high.
treated.
Okay. No, that makes sense. That does. That makes sense. Because, like, when I went to the doctor's the last time, I couldn't find the office. So when I got in there, that's the
Yep.
first thing they do. They weigh you and they do the cuff. And she's like, oh, your blood pressure is high. I'm
Yeah.
like, yeah, because I couldn't find you and I got excited. I didn't want to be late. I didn't want to miss my appointment. But it was never explained to the extent that you just explained it. And you made it very clear yesterday. It's important where the cuff is, how often you do it. And then that's another thing. How often should you do it? You were speaking with my aunt yesterday. You had those
That's
questions.
your aunt?
Yeah, she's throwing
Oh,
them
cool.
questions at my aunt like that.
Like that.
She didn't know the answers. No, but the left and the right.
Yeah.
So I did the right and it's high. I go to the left automatically or no? And then why would you change the arms? You understand what I'm saying? Like,
Yeah. Yeah.
does it
So,
make sense?
It does. There are, so a couple things. In the office, there is something called white coat hypertension. You guys heard of that? There's also the opposite. It's called masked. I can't even say it with this thing on masked. Hypertension. So it really looks like you're normal in the office, but you're really high when you get out.
Okay.
So there's those things you kind of have to pick up. But there are some conditions, and they're not really common, but you can have a difference in the blood pressure in one arm over the other, and it's usually from a vascular problem, right? One gets tighter, we'll call it coarctation of the aorta, big weird things. But what it means is if one of your arteries is tighter, the blood pressure is going to be down. So the other one that's higher is the right one. Okay. So, because you get people come in, they'll have this one, they're like, no, my pressure's nice and low. Yeah, okay, no, it's not.
Okay.
So what are some of the signals that a person would know, or that a person can look out for to see if their pressure is high, besides being dizzy, or what are some of the signals?
By the time, so hypertension is really actually called the silent killer. By the time you get dizzy, lightheaded, short of breath, chest pain, those kind of things, it's too late. We call that
Okay.
hypertensive emergency,
Okay.
right? As in, when I was growing up, we'd bring you in the hospital, put 2 different IVs in you, and just kind of get it down as quickly as we can. Safely but quickly. So you won't know, is a short answer.
Okay.
Certain things you should find out as time goes on is you should check your pressure, your kidneys. You should have a kidney doc or your general doc pay attention to it every so often. If you have conditions that you think are thyroidish, where you're like always hot or always cold or always revved up or sweaty and, get tremors and all those kind of things, and you think maybe this is thyroid is associated with hypertension. In other words, there's a term, primary hypertension or essential hypertension. That's when we say we don't have a diagnosis. We don't know why you're hypertensive. It just happens. There are other doctors out there who feel that's not true. That hypertension is always due to something else. You just haven't figured out what it is yet. So paying attention to you, your body, like when you go to the bathroom, are you peeing bubbles? You ever heard of that?
Yeah.
Like you
That's
get
what
all
they say. That's a
sudsy.
kidney
That's a
sign.
kidney thing, and the number one reason for kidney problem is hypertension.
Pressure. Yeah, blood pressure.
Yeah.
What about
also diabetes.
swelling in the ankles,
Swelling can do
the
it, too.
fingers, the wrist? You know what I mean?
Yeah.
What about those type of things? Because some
So-
people say, "Oh, I wake up," or somebody, by the time I get home, my feet are swelling because I'm standing on my feet all day long. And I've been standing on my
Possibly.
feet forever, and my feet and ankles wouldn't swell. You know what I mean? But I notice when I'm eating certain things, because sometimes I'm habitual of some of the things that I eat, right? And there's this one thing that I like sometimes, and if I eat a bag of it in a day, my ankles will swell, and I never had that problem before.
Potato chips.
No, actually, it is a chip, but it's not a potato chips. It's the tortilla chips, but they're salty.
Ooh, yeah.
You know what I mean? They're
Yeah.
salty, and when I have them, but then I'm on a binge, and then I stop, right? But what I noticed this time on my binge, my ankle, I got a little pocket right on the side of my
Makes sense.
ankle. You know what I mean? And so I do the dry brushing. I do do all those things, right? And it subsides. But still, at the same time, I'm like, ooh, this is new. Hold on, back up. So I threw the chips away. I can't have it because I know what that's doing to me. And then my husband will buy some. Oh, I bought some more of your chips. I'm like, yeah, I'm not having it anymore. What do you, I said, because this is what's going on when I have them, even if I
Yeah.
have just a couple.
Yeah, no, that's true. It's salt.
Yeah.
You know, so yeah, high blood pressure worsens that if it causes hypertension that then backs up on your heart, that then causes heart failure. And heart failure doesn't mean, transplant. I was trying to impress that yesterday. It just means that your heart's failing to go forward, which means all the
Not
blood
pumping
goes
properly.
backwards.
Yeah, it's not pumping properly.
And then the swelling. I mean, some people do get swelling just because they're fat, right? Some people get swelling because there's something wrong with the veins. Some people get swelling because there was damage in the past, varicose veins. There are a whole bunch of different reasons. So you can't just say swelling and start thinking hypertension.
Right.
But you do
But
think
when you know your
hypertension.
body.
You got to look for it. Yeah, pay
Yeah.
attention. And so, something's wrong. That's where you and your doc have to be partners. Like, you don't go and you talk to a doc and he or she is in, some authoritarian mode. And all of a sudden, they're telling you what to do and how to do it, and you have no clue what's going on. Those are the ones who have a hard time. So, yeah, it could be blood pressure. That's when you start measuring it. Your blood pressure could be high and it still not have anything to do with the swelling.
Okay.
So, so it has to be a bit of an evaluation. It has to get a whole lot deeper. And yes, if you do salt, it will make you swell. But here's the thing you also got to pay attention to. If you're swelling on the outside, by the time it gets to the outside, imagine what happened inside.
Don't do that to me.
I'm sorry. There's a whole different. So you see people who are fat, right? I should say obese, right? I should be politically
Yeah, because you
correct.
said that yesterday too.
should.
You said
Yeah.
sleep apnea is for fat people. I'm
Yeah,
like,
I
But that's
should.
not
What?
true. I know people with sleep apnea
you-
that are
yeah.
smaller than I am, but they
Yeah.
have a lot of cardiovascular issues,
Issues.
and
Yeah.
kidney issues too.
So the point there with sleep apnea will cause a lot of cardiovascular disease.
And
Obstructive
diet.
sleep apnea is often from obesity, but it's often from it's also from how close your throat closes while you're sleeping. There's also central sleep apnea, which has nothing to do with your size. It's all about neurologically. You kind of forget to breathe when you go to sleep, not
Okay.
intentionally. But no, I should say obesity, but I'm talking about fat people, right? Because y'all young woke people, man.
We do.
Ah,
We do.
I just
Go
want to
ahead.
cancel people. Well, because it is.
not at all. No.
Because fat is fat, right? I mean,
It
it's
is.
either bone, it's protein, it's water, it's fat. I mean, I'm not going to say, well,
bone?
it's not water, it's,
Big bone.
hydrogenated oxygen. Like, come on. The water's water.
It is what it is.
Fat is fat.
Right.
So,
Keeping it simple.
but part of the problem is, where is your fat? Is it internally, like close around your organs, which is what we call visceral fat? That's the bad one. That's really going to hurt you. Or is it that sub-Q jiggly thing like sumo wrestlers have? They're like really relatively healthy. Well, relatively healthy, but they got all this fat underneath the skin, and it's like jiggly. It's not really as much of a problem from a cardiovascular perspective.
Don't tell me that.
Right, I won't tell you.
I need to lose that.
But you guys know those people too, right? They look normal, like from the back, and then they turn to the side, and they got
Yeah.
this big belly.
Yeah.
A lot of times that's the visceral stuff. And then, even if they take their shirt off or whatever, it's not really that much under the skin, but it's still a big belly.
Right.
If it's not, a hernia, it could really be a lot of fat right around the liver, right? Where's the fat going to go? It's going to go around the liver first, then around the pancreas, then around your intestines, then it gets into the muscles, and you just get bigger and bigger. So back to the muscle thing.
Wow.
Let your muscle burn up all that fat by staying active.
By staying
Okay.
active.
Yeah.
You don't have to go bench pressing cars or anything like that. Some of those guys yesterday looked like they were, right? You saw
Yeah.
how swollen some of those.
Yeah.
I'm like, bro,
Yeah.
why you?
They're some of them are trainers though, and I think it's just for the love of the working out.
Yeah.
That's what it is.
But I mean, I've known people that look like that in I know somebody personally that looked like that, and next thing you know, they died.
Yeah.
You know what I mean? And so it's like, what is the reason for that? They stay in the gym, but they still have asthma. They have respiratory issues, things like that. So, what could be
Other
talk
things.
about that?
Yeah, you can't, exercise your way to health.
Right.
To good health. Yeah, you exercise to make you healthy. You can exercise to preserve some health, but you can't buy health from exercising.
Exercise.
Yeah. So if there's something that's going to happen to you, like cardiac disease, anyway, cancers, other kind of illnesses, if they're gonna take you out, they're gonna take you out. Exercise all you want to. Depends on how that person died, the person you're talking about. There's some people who go to bed and just don't wake up.
Yeah,
And
that's true too.
Yeah, or even talking to you and just fall down and that's it.
Right.
We call it sudden cardiac death or sudden cardiac arrest. It's almost like what your boy LeBron James' son had, or the other guy, the football guy, got hit in the chest. Those things can, when your heart just stops like that, you're pretty much, it's
Can't do much about it.
yeah.
My cousin had my cousin's 28-year-old son just passed away. He just dropped dead, had a heart attack. Like no symptoms, no medical diagnosis that we knew of, but she had heart surgery. So does that mean could be something that's hereditary and we just never knew?
Totally about to say that. Tell everybody who's related to him within 1 degree, get an EKG,
Yeah.
and then see your doc. 'Cause
Yeah.
there are some things, congenital problems. There's congenital EKG problems where the electricity through your heart doesn't run right. You know,
Okay.
That's where heart palpitations and things like that
You can
happen,
get
and
palpitations.
we think that oh, okay, you know what I mean?
My heart fluttered.
Oh, I'm just a little bit
yeah.
overexcited right
walking
now.
by,
Yeah.
Yeah.
And she looked great, and then my heart just skipped a beat.
Yeah.
That kind of I know.
You said we weren't going to go there.
Oh, we're not good.
My goodness. So, okay. So what time is it? We got to pay attention to the time.
It's
today.
10:11.
Okay.
I talk too much.
Um,
No,
No.
This is great
I was
information.
about to say this
no,
is
we
really
we
good
love
information, and it's different from what you hear. You know what I mean? Like, so this
Right.
conversation is different from what your normal conversation would be when you're going to your doctor, like what you said, when you go in and it's an authoritative
See?
type
It's
situation.
this microphone.
If it's an authoritative conversation,
She tried it
that-
again.
Yeah,
Easier to
right.
say endothelial.
Yeah, right. Anyway, so what are some of the questions that people should automatically, when they're going, especially if they're going to their family physician and their family physician is saying, I need you to go see a cardiologist, or I need you to go see what is it?
Endocrinologist.
No, that's not what I'm.
The diabetes
Nephrologist.
specialist? Oh,
Nephrologist.
yeah.
Right. And or whatever specialist, right? But they don't give them the questions to ask them. They just say, I'm going to send you to see Dr. So-and-so, right? Because your blood work came back this way, or your heartbeat is a little off today, and it's been off the last few times I saw you, even though it's 6 months in between, right? So what are the type of questions you should have or give them to say to the person that they're going to see? Because now I'm nervous because you're sending me to a specialist. That means something's wrong. Okay, instead of, okay, we're just double checking to make sure what I heard is what I heard, or what I think is what I, get confirmation of what I'm thinking. But what are the questions that the patient should ask when they go?
I like when patients act like they're talking to me, like they would talk to me on the street, right? Because here's part of the problem that y'all patients do. It really kills me. Y'all get in the office, and all of a sudden, we're talking with each other, we're hanging like this, and all of a sudden you get in the office like, oh my gosh, doc, what's going on
Yeah.
next? Kill that, right? So if you see me on the street and we're talking, you're going to do the same thing. If I say, hey, Shawne, you need to see so-and-so. Why?
Right.
What you doing? Why? What's the matter? What do you
Yeah.
think? Oh, you heard what? Why? What did you hear? That kind of stuff.
Okay.
Ask it just like that. So, number one, that only
You got to
happens when
come
you get
closer
a
to the
good.
microphone. You're going in
Number
and out.
one, that only happens when you have a good relationship with your doc, and then that goes back to what the other brother was saying about having doctors who look like you, who can understand you. You can have that kind of relationship. But in terms of the questions, think if you can't think of what to ask. I always tell my patients, don't
Call
walk out
Dr.
of
Smith.
here.
No.
Yeah, you can do that too.
Right.
I do that for friends. I'm like, yeah, just ask me and I'll tell you what it means. But no, one of the things I tell them is, I tell patients, don't leave here unless you understand what I said. Right? But that's on my side.
That's what I was
But
going
you
to say,
guys
because
need
I
to
don't think,
ask.
doctors don't make you feel that comfortable all the time. Well, let me not say that. I'm pretty comfortable with the ones that I have, but I don't think you normally walk in there and feel that comfortable.
Because they're not all from Waterberry. So
I've,
that's part of it.
True.
I've had a
Long
doctor
Hill.
say to me, don't get too cocky
Why?
because I
You were
did
asking
some things.
questions?
Yeah, I did some things, and then I said, hey, with my grandmother,
Mm-hmm.
I said, I haven't given her that since April. It was August. And he goes, don't get too cocky.
Oh, wow.
And I said, I'm not trying to disrespect you. I said, what I'm saying is, when I noticed when I gave it to her, this is how she was. She was loopy. She was this. She was that. Blah blah blah. And I said, so I stopped giving it to her, you know, because it wasn't helpful.
Sure.
You know, and we weren't going to see him until August. And so when he says, oh, you can stop giving that to her because I don't like her numbers. It was digoxin.
Yeah, that could be an issue.
Yeah. And
Well-
I noticed it right away. And when I said to him, I said, no, I haven't given it to her. So and that's how he said, don't get too cocky.
Wow.
So from that point, I was like, yeah, we're done.
I don't know what that means, but here's the thing: in that actual in that interaction, there should probably been a better discussion between you guys. Digoxin is a great medicine, but it's very dangerous. And then there are medications you can't just stop, so you could have hurt her depending on
Either
the medicine.
way, I know.
But yeah, but that has to be a discussion, right? And kind of like what I said, like, you know, get all the information. I'm gonna give you my best, you know, recommendations if you're a family member, but we're gonna go the way you want, but argue. But either way, the thing has to be a plan, right? We have to go together. But so I guess then the short way, what I also tell patients, friends, cousins, Roman countrymen, that think of the who, what, where, when, why, and how, right? Who has to go to the hospital? I mean, who has to go to the referral? When? Why? What are you hearing? What is the problem? What am I expecting to hear? And anything that fills in after the who, what, where, when, why, how. At the end of that, you should be fine.
And they should have a more respect for you as a patient too, and you have more respect to the doctor, also, because if they take that time to answer those questions, the who, what, where, and why, so that I understand it, you know, especially if you're going by yourself. A lot of people go to the doctors by themselves, and they really shouldn't, especially when they're sending them to a specialist, and it's like, yeah, I need somebody to come with me just in case I don't understand something. Or you get so nervous that you know,
Forget it.
it's like blah, blah, blah. You don't
Right.
hear it, like wah, wah, wah,
Yeah,
right?
Charlie Brown.
Yeah,
Right.
yeah. But, you know, I've always been an advocate for myself anyway. When I think about way back, you know, I just make decisions and I go, that doesn't feel good, so I'm not doing it. You know what I mean? But having that conversation, I've only divorced one doctor.
Okay.
That's what I
It
said.
wasn't a cardiologist, was it?
I don't have a cardiologist.
Oh, yeah, it's just- yeah.
But
Okay.
I don't divorce. I only divorced one doctor, and that was because
Tracy got
she was. That was because of the conversation. Like, she just disregarded any question that I had, and she didn't have the right information. She was like, "Oh, you know, your brother." She's looking at my chart. I don't know whose chart she was looking at because it wasn't mine. And she says, "Oh, so your brother died from a heart attack, and you know, your mother this and your mother that." I said, "No, my father died." You know, I said, "I don't know whose chart you're reading," and she got offended. And I'm saying, but you have the wrong information. You know what I mean? So I divorced her. And then my grandmother was going to the same doctor, and she was complaining about her doctor or whatever. Come to find out, it was the same person.
Wow.
So my grandmother did the same thing, and I took her to the person that I found. And and I love him because he asked questions first. What's going on?
Yeah.
How have you been? Okay, last time you were here, it was this. Do you have any questions? And he was the same way with my grandmother and my mother.
Yep.
You know what I mean? So
So-
it makes a difference because they're important to you,
Right.
you know? And that white coat syndrome, right? It's like some of them are arrogant to a point where it's like, you don't know, I know.
I'm the doctor.
Do what I say type of thing. And it's like, no.
There are a lot of dynamics in that that you probably don't want me to get into all in this show, right? Because, yeah, what you're saying is great. What we're talking about is ideal. The flip sides, the corollary to these, there are, you know, that doctor lives are crazy now. They're not the same.
Right.
Number one. Number two, insurance lives are
yeah.
not the same. Hospital lives are not the same because now you have administrators really trying to say, no, you have
Dictate.
to get by 25,
Yeah.
35 patients in a day.
Yeah.
You know, time to figure this stuff out. And it's probably another talk if you guys
That is
want,
another
but,
talk.
Yeah. We'll do a part
yeah,
two.
We're going to have to do a part two.
You're not going to want that. But, you know, there are a lot of things.
You
Then
might
there are
need
nurse
surgery.
practitioners. Then there's the whole the whole element of the PAs versus the nurse practitioner. Who's going to sit and talk to you? Who has to earn their keep?
Respect and
No,
trust.
before that, they have
They got to earn their keep. Oh.
Mm.
Yeah.
So there's like the agenda before
Well,
the patient, before you get to the patient.
Well, that's part of the hard stress for some of the docs. A lot of the pain. Why most of the docs who actually recruited me have quit. They all got their MBAs and they've jumped. They're like, we went into medicine to do one thing, to talk and have all the stuff we're talking about.
Yeah.
Then you get in, there's a whole other world, whole other world, something
Behind the scenes we know nothing about.
It's kind of hard to justify paying a doctor $20 when he does $10 worth of work. And then we're like, well, we can get 3 or 4, other people to do $10 of work for $5, and then, your health, our relationship, our outcomes, really gets translated into a couple of dollars.
Yeah.
And, docs don't like that. So a lot of times you're going to see docs who are frustrated with the system more so than you. Not defending docs in your relationship.
And it's not about defending, but yeah, because the thing about it is you're sharing stuff that we wouldn't take into consideration.
Think of, yeah.
Right.
And then you also got to remember, I went into medical school because I loved the science and I wanted to do that. I was really good at it, et cetera, et cetera. But not every doc is trying to go there to be. Not every doc is going to be interested in customer service. We're there for science.
Oh, that's another conversation.
It's a whole other conversation. I don't really think a lot of docs want to be judged by how well they made you smile or how well they made you feel. But they're like, look it, I'm here for the science. Call me for someone else. I've had other docs say, listen, I forgot, some lady asked something. And somebody talked to someone who talked to the attending physician. He's like, look, get your love at home. I don't have time for this. Wow. We have to do a procedure, and we had to get done. Guess what? This is one of the best surgeons ever. So he's the guy you did want to see.
Right.
Wow.
And it's so funny.
That's kind of hard because I want to feel comfortable, though.
But
I don't want you to.
The patient.
What?
No,
right, exactly.
yeah.
But
You
at
hear
the
the
same
point.
time,
No, yeah.
the patient feels it, right? The patient feels it. But
Right.
this is where nurses come in, right? I think the nurses are the ones that are the ones to make sure that you're good and this and that because the surgeon is like,
know.
I just got to do what I have to do.
Yeah.
You know what I mean? And let's get it done. And he has another patient right behind you and another patient right behind you, so he doesn't have time for fluff. You know what I mean? So that's where these other people in between before you get to him are the fluff.
They should fluff you?
Right. Well, yes, to a
Tea
certain
and
extent. That's the fluff, I remember having surgery and an anesthesiologist came in and the person that put the pick in my hand, whatever it's called, it was so painful.
What's it called, Doc?
Well, it sounds like she just put an IV. You
Yeah, the
gotta
IV, right.
Yeah, pick
It
line.
was so painful, and I'm saying, this is painful, right? The lady just did what she had to do when she went out. She was the nurse. He comes in, and I said, and he was fine too. He was fine, right?
She remembers
That's
that.
important. That's important.
She was in pain, but she remembers that.
Right, and so he comes in, and I said to him, this is really painful. And he said, don't worry about it. I mean, you're going to be out in a minute. And the way he responded to me, I wanted to kick him.
Wow. Why?
I didn't like that bedside manner was just not there. It was just not there, right?
See, the nurse didn't fluff you before, though.
Right, but what I'm saying is, I don't want to feel like that, and y'all about to put me to sleep, and I don't know what's going to happen after. You know what I mean?
Right.
But then the nurse that came behind him, he must have told her, right? And so she says, I understand, da-da-da-da. She's like, but we're getting ready to give you the Michael Jackson drug. She says, and you're going to be out. You're going to be out quick, right?
Yeah.
And I was, because
That
I'm a
would've made me
lightweight.
nervous.
I don't have surgeries and I don't have
good job.
medications and stuff, right? And so even the way I woke up, they were surprised because I woke up, all right, could I get some tea? Can I get some, and they were surprised because I had no grogginess, no nothing. You know what I mean? I had none of that. And so, but I didn't see that man again.
It's probably propofol.
I don't know what it was, but it was,
That's a great drug, by the way. Because I did cardioversion. People have atrial fibrillation, a really bad thing. It's one of the big reasons for stroke, especially if you have hypertension, by the way. Back to hypertension. That's what we're talking about.
Right.
Hypertension leads to AFib, and then they get strokes, and they're like, oh my gosh, what happened? Anyway, one of the ways we treat that is cardioversion. And I love it because it's like you start giving it. Well, I don't give it. I call the anesthesiologist to give it. And I'm like, yeah, go ahead and give it. And then you just count them back. They were like 199.
Out. That was me. That was me. Absolutely.
And then you wake up like nothing happened. Like, are we going to get this thing started?
Exactly.
Like,
Exactly.
Yeah.
So,
I love that.
But
It's
anyway, I digress.
This was a
With an
awesome
anesthesia,
interview,
sorry.
and we got to have him back for a part 2 because
Yes.
there's so much information
Yeah.
in that
But I like
head that we
also
need to get into.
that he talks about YouTube.
No, honestly, okay. Let me get serious. Doc, we appreciate you coming and educating us.
I can't take that. How do you do this? Every week you guys meet once a week?
We have a good time. We have a good
We
time.
grew up together. We're best friends
yes,
from way back.
Absolutely.
Yeah,
Yes.
we grew up.
From
Oh,
toddlers.
wait, you from
So you
Berkeley?
really
do
did.
you know
Oh,
Gear Drive,
yeah.
Pearl Lake?
No,
You know
he
up
don't.
there?
Pearl, of course.
Listen,
Yes, we
remember,
grew up
he's
out
young.
there.
Really?
Remember, he's
No, he was.
he's a baby.
No, I'm the youngest.
You're the
Yeah,
baby.
don't.
Tell me what this means?
Oh,
I'm not the baby.
he's not
of
the
family.
baby. He's
I'm
the youngest,
He's
and
the
there's a
youngest.
difference because. Can I say it on air, or you're gonna get beat up?
I probably will. But
Okay, I won't say it, but there's a difference, and he explained it. We'll talk
Okay.
about it out there.
Tell my sister. Yeah,
Yes.
you know my sister.
Absolutely. Matter of fact, I'm gonna text her the picture of us.
Hey, she used to beat up all the boys. Still does. So yeah,
Love
my
her.
sister.
That's
She
my
knows who
girl.
she
That's
is.
my girl. Yes. Yes. Okay. So
Yeah.
we
At
have
the
to
same
wrap
time.
up
Oh my
because
gosh, that was funny.
it's
We're in tune. This is my sister from
Absolutely.
another
I see.
mother.
absolutely.
But do you go to Kennedy?
No, I went to Crosby. Nobody went to Kennedy.
NVL back to
I
back
mean,
to
she
back
went to Caner, but
champions,
no.
1991,
I did go to Kennedy.
I went to
90,
Crosby.
89, Malik Jerome, Dave Smith. Yeah. Kennedy.
No
Right.
way.
That's all right. That's all right.
Crosby.
I heard.
Bulldogs.
So yeah.
I ain't
I
even
think-
gonna get in that conversation.
Because you went to Caner Tech.
Yeah,
Yeah, really. You don't
Oh,
have.
I went for a purpose.
You don't have a dog in this fight.
I went for a purpose. Okay. I
We
can
didn't
play
go
with
to
my
school
friends
for a
after
purpose?
school.
Okay, and on that note, Shawne's going to wrap it up. But we will
Thank you,
definitely
Shawne.
have Dr. Smith back again because
Yes,
we totally
this was fun.
enjoyed
This was
this.
fun.
Please, yes, we did.
But we
did.
definitely have to get back because his way of thinking
Yeah.
about what he does and how he treats his patients is intriguing because it's not a conversation that's normal. It's not a normal conversation. Not from my experience, not from, listening
No.
to clients as a wellness coach, you know what I mean? Not from that perspective. And so we definitely want to have you on again to go deeper,
Yes.
and get into that conversation that might be a little controversial that you said,
All
you
right.
really want me? You
Don't
really want me
I was
to?
trying to be nice today.
You were very nice.
Not at
You
all.
were very nice.
I didn't say 98% of what I was thinking.
Really?
Right. And that's
Sure, don't
great.
believe him.
That's great. I believe it.
I don't. I believe this
But
man.
we're gonna wrap this up. So
All right.
tell us where you are, right? And if you have a website or if there's something that I know you get into the wellness piece of things too. So how could they find you if anyone has questions? If you have questions, also you can put them in the comments, and we'll make sure that he gets those questions. But in the meantime, if you
That's
have a
the best,
website or if there's something somewhere someone can
So-
contact you.
This is where I'm all up and down the East Coast, right? So I have a practice in South Carolina, Premier Cardiovascular Care and Wellness, and that's www.pcvc.
Say it again, because you are mumbling.
www.pcvcare.com.
Okay.
Yep. So that's Papa Charlie Victor Charlie Alpha Romeo Echo.com.
Okay.
Okay.
So that's the best way you see what we do. I don't know. I hate that term wellness, although it's part of what we do. I hate the term holistic because what does that mean? Most people think differently. I like the term integrative, but we're all on the
Yes,
same
integrative,
page.
yes.
So it's
Integrative.
cardiology has to be integrated. So that's where one practice is. But then I live and also work in North Carolina, and like you said, I'm on teaching faculty here in Connecticut, New Haven.
Okay.
So I'm up and down.
Nice.
Okay.
Nice.
All right.
So next
awesome.
time you're back in Connecticut, we got to make sure you come back on the show.
Yeah, absolutely.
All right.
You got to let us know.
Yes.
All right.
And
said
just
that.
say, listen,
Remember you said that.
I'll be in
Just-
town. So I have something to say.
Yes.
And be censored, right? Yes, I understand.
Yes.
I will be censored.
Yes, to a certain extent.
Yeah.
You
Like
know,
I
at
can
the
still use
same
the word
time.
fat though, right?
Are you going to stop using it?
Oh.
Right. I
You're
mean,
not
if that's
gonna
part of your
stop.
vernacular,
It is-
there's not we can
I
do.
mean,
No,
you-
it's a bio. I'm using it medically.
I'm
Yes,
not mad
you
at
are
you.
using it
I'm not
medically.
mad at you. Fat
We're
is
not
fat.
calling any one particular person
No, we're
fat. We're
talking
just
about
saying Right.
substance.
The substance
That's
of
it.
it.
Yeah.
You know, what it means to be and what
have
you
a
can
lot of
do. Right.
I
Exactly.
mean, you guys
and
call
what to
people
do about
sweet,
it.
but y'all don't mean they got sugar, huh? I'm
You
sorry.
know what? I'm
I don't
done.
call people
I don't
sweet.
either. We don't call it people.
Don't call nobody sweet.
Let's wrap this up.
All right, we're wrapping up.
Let's wrap this up. So we did
Yes.
not do our breathing at the beginning, and
That's
we did
okay.
not do our devotional, but we can close out with our devotional at least.
This one right here. Go ahead. Get down with the get down, sis.
Let's close out with our devotional. You know, we got
Yes.
sidetracked today. I
Definitely
don't know
do
what
that.
the deal is.
Instead of that peppermint breathing thing.
Today is, I know,
Oh
he
my
didn't like our
goodness.
peppermint. I was surprised. First,
And our
first
guests
time
usually,
ever.
our guests usually, unless they're
they're
being
ready.
they like it.
Yes. I'll talk to you guys later.
Okay.
All right, so we're reading from Jesus is Calling. It's June 29th. As you get out of bed in the morning, be aware of my presence with you. You may not be thinking clearly yet, but I am. Your early morning thoughts tend to be anxious ones until you get connected with me. Invite me into your thoughts by whispering my name. Suddenly your day brightens and feels more user-friendly. You cannot dread a day that is vibrant with my presence. You gain confidence through knowing that I am with you, that you face nothing alone. Anxiety stems from asking the wrong question. If such and such happens, can I handle it? The true question is not whether you can cope with whatever happens, but whether you and I together can handle anything that occurs. It is this you and I together factor that gives you confidence to face the day cheerfully. And that's from Psalms 5:3, Psalm 63:1, and Philippians 4:13.